Good evening. Thank you for coming. My name is Alma Naddafi. I'm one of the nurse practitioners currently working here in the Red Blood Cell Disorders program here at the Toronto General Hospital. So thank you so much for your time and for your willingness to attend this very special event. This is a joint effort between us here at UHN, the Hospital for Sick Children, SCAGO, and of course the Thalassemia Foundation of Canada. And I know that there is representatives of all these great institutions here in the audience. So this is the official welcome, where we actually post it and say welcome. I don't know if you can see the agenda, but I'll briefly describe what we are going to do here today. So we will initiate with your life so far in white transition, presented by Dr. Kirby. Of course, dinner, we are off track with time, so we will skip that. And Doris Baxter will present to us, along with Marcia Palmer, leading Hospital for Sick Children and getting ready for the transition here at UHN, and more specifically the Toronto General Hospital. Then my colleague Jennifer Reisan is going to talk about arriving at UHN and really give you a brief description of where you need to go. And we will also talk about navigating the adult healthcare world. Also, one of our colleagues here, Heather Gordon, who is our social worker here in the program, will talk about social support as an adult. So you're more than welcome to ask any questions during any of these sessions. And we will talk about the patient experience so far. Then we will join in a small group discussion and really team up about discussing the healthcare system and how we can work together as partners. And of course, there is always a question and answer session, and led by Dr. Odami, and we will end up by summing up in the future by Dr. Ward. Okay? So the first presenter is Dr. Kirby, who is going to be introducing us to your life so far in white transition. So please join me in welcoming Dr. Kirby.
Hello. Good night, everyone. Good evening, everyone. I just have a few points to make, and I'm not sure it's exactly the topic, but I'll make them anyway. Advances in modern medicine has led to many patients with pediatric conditions, which once were considered fatal conditions, with these patients living into adulthood. This increased survival rate is a cause for celebration. Not only are patients with sickle cell and thalassemia surviving, but doing so in a very healthy way, with life expectancies approaching non-sickle cell, non-thalassemia patients, peers, and this is all very good, but it comes with new challenges, and we're all here to face them together. Adolescents and parents have concerns about leaving a familiar setting and leaving their treating team, who they've had. One mom just said she was bringing her son to sick kids since 6 months of age. This leads to some separation anxiety on both sides, not just for the patients leaving the pediatric environment, but for the pediatric caregivers giving up their patients, because these are all our children. As Doris just said, I said, you're young people. She said, they're still our children.